Basic urethra function. The urethra is a thin, tube-like structure that acts as the final pathway for urine to leave the body. In both males and females, it connects the bladder, the storage place for urine, to the outside world. When the bladder fills up, nerve signals tell the brain it's time to urinate. The bladder muscles then contract, while a ring-shaped muscle called the urethral sphincter relaxes. Although the urethra's basic role is the same in everyone, it is part of two different systems depending on biological. During urination, the pathway for semen is blocked by a special valve-like mechanism, and during ejaculation, the urine pathway is closed to allow only semen to pass. Because it's essential for waste removal, any problems with the urethra, such as infections, narrowing strictures, or injuries, can cause pain, difficulty urinating, or more serious health issues. Infections of the urethra, often called urethritis, are more common in women due to the shorter length of their urethra, making it easier for bacteria to travel to the bladder. Understanding the urethra's basic function is important before exploring its relationship to childbirth because its location and surrounding structures can be affected by pregnancy and delivery. Male vs. female urethra structure. While the urethra serves the same general function in both men and women, its length, position, and additional roles are quite different. In men, the urethra is significantly longer, averaging about 18-20 cm, 7-8 inches, and passes through the prostate gland, the pelvic floor muscles, and the length of the penis. It has three main sections: the prostatic urethra, the membranous urethra, and the spongy penile urethra. Besides carrying urine, it also serves as the channel for semen during ejaculation, making it part of both the urinary and reproductive systems. In women, the urethra is much shorter, usually around 3-4 cm, 5 inches, and opens just above the vaginal opening. Because it is shorter, urine passes through more quickly, but this also makes women more prone to urinary tract infections, UTIs, since bacteria have a shorter distance to travel to the bladder. The position of the female urethra, so close to the vaginal canal, has implications during childbirth. As the baby passes through the birth canal, the nearby urethra and bladder neck can experience pressure or stretching. In men, the urethra's distance from the reproductive passage means childbirth does not directly affect it. But in women, this close anatomical relationship is highly relevant. Proximity to reproductive organs. One of the most fascinating aspects of female anatomy is the close proximity between the urinary and reproductive systems. In women, the urethral opening is located just above the vaginal opening, and both are positioned within the pelvic region. Just behind the bladder is the uterus, and the vagina runs from the cervix down to the external opening between the urethra and anus. During pregnancy, the growing uterus sits directly above the bladder, increasing pressure on it. This is why many pregnant women experience frequent urination. The bladder has less space to expand. During childbirth, the baby passes through the vagina, which lies only millimeters away from the urethra. The stretching of vaginal tissues and pelvic floor muscles can temporarily affect the urethra's position or function. This proximity also explains why urinary issues can occur after childbirth. The physical strain of labor may slightly shift the bladder or urethra, or weaken the sphincter muscles that control urine flow. In rare cases, more severe injuries can occur, such as urethral tears. especially if instruments like forceps are used during delivery. The anatomical closeness of the urethra and vagina is unique to females and is a key reason why understanding pelvic floor health is important for both urinary control and reproductive recovery. After giving birth, pelvic floor support. The pelvic floor is a group of muscles, ligaments, and connective tissues that act like a supportive hammock at the base of the pelvis. It holds the bladder, urethra, uterus, vagina, and rectum in place. These muscles not only help control urination and bowel movements, but also play a critical role in sexual function and childbirth. During pregnancy, the pelvic floor muscles stretch to accommodate the growing weight of the uterus and baby. These same muscles help support the urethra by keeping it in the correct position and ensuring the sphincter works properly. If the pelvic floor becomes weak, the bladder or urethra may shift slightly, leading to urinary leakage, incontinence. Childbirth, especially vaginal delivery, puts significant strain on the pelvic floor. As the baby passes through, these muscles can be stretched or even torn. Recovery varies, but without proper strengthening exercises, some women may experience lasting weakness. In men, the pelvic floor also supports the bladder and urethra, but because they do not give birth, the muscles typically remain stronger throughout life unless weakened by age, surgery, or illness. However, pelvic floor exercises can benefit both men and women by improving bladder control and overall pelvic health. Childbirth impact during vaginal delivery. The baby's head and shoulders stretch the birth canal to its limits. Since the female urethra is located just above the vaginal wall, it can be affected by this stretching. The pressure may temporarily displace the urethra or stretch the sphincter muscles, leading to short-term urinary leakage in many women after childbirth. In some cases, prolonged labor or the use of forceps/vacuum assistance can increase the risk of injury to the urethra or surrounding tissues. While most changes are temporary, a small number of women may experience longer-term problems such as stress incontinence, urine leaks when coughing, laughing, or exercising. Another factor is nerve damage. The pelvic nerves that help control the bladder and urethra can be stretched during delivery, temporarily reducing muscle coordination. Fortunately, with time and proper recovery exercises, most women regain full bladder control. Understanding these changes is important because it helps new mothers know that urinary symptoms after birth are common and usually treatable. Post-birth recovery after childbirth, the body begins a healing process to restore the pelvic region to its normal state. The urethra and bladder may feel different for a few weeks as tissues recover from stretching or minor trauma. One of the most recommended recovery steps is pelvic floor exercises, Kegel exercises, which involve repeatedly contracting and relaxing the pelvic muscles to rebuild strength and control. These exercises improve urethral support, reduce leakage, and enhance overall pelvic stability. Hydration and bladder training also play a role in recovery. Drinking enough water helps flush bacteria and prevents urinary infections, which are more likely in the early postpartum period. Avoiding excessive straining during bowel movements and heavy lifting in the first weeks after birth also protects healing tissues. In rare cases where urinary symptoms persist beyond 6 months, A pelvic health physiotherapist or urologist may be needed for further evaluation. Treatments range from guided exercises to minimally invasive procedures. Post-birth recovery is not just about the uterus and vagina. The urethra and bladder also need care. By understanding their connection to childbirth, women can take proactive steps to support lifelong urinary health.